Fox 45's Bmore Healthy Expo is just 2 days away. We are helping you live your healthiest life. Part of how we're doing that is helping you get the much-needed screenings you need. Everything from high blood pressure to cholesterol screenings. But once you get the results, what do those numbers really mean? Jack Goebel, the academic coordinator of the Towson University CCBC Essex Physician Assistance Program, joins us this morning. Good morning.
Good morning.
All right, so some of the students from the Physician's Assistant Program are going to be the ones at the expo doing all these screenings. Is that right?
Correct. Correct.
What are we talking about for screenings? What are the different ones people should make sure they get?
Right. Well, some of the focus of these screenings are going to be related to adverse events that some of these diseases can cause. So one of the first focuses will be on diabetes.
Okay.
We're going to be screening for diabetes and talking a little bit about that. Over 21 million people in this country have diabetes or are affected by it.
One of the other big ones that we saw this a lot last year, the high blood pressure screenings. We even had people who came to the booth and were so high and so at risk, they left from there and went on to the hospital.
Correct. I'm sure that occurs, yes. Hypertension or high blood pressure in this country is a major health risk as well for a number of different illnesses, heart disease, stroke, and renal disease. Many people don't realize that, but renal disease, it's a significant causative factor. You're looking to have a blood pressure of 120/80 or less, considered normal. 120/80 to 140/90 is kind of a gray zone. It's a pre-hypertension zone where we actually really try and focus on a lot of lifestyle modifications, weight reduction, smoking cessation, lower sodium diets, and those sorts of things. And then above that level is certainly considered hypertension. So those are levels certainly where if you're above 120/80, you definitely want to seek medical care.
Right away, yeah. We had a few people who ended up doing that last year, and hopefully that saved their lives in a lot of ways. Cholesterol screening, another big one?
Correct. Yeah, when we talk about cholesterol, there's basically three things that we're going to be talking about there. The total cholesterol level, which is all the cholesterol rolled together, as the name implies, which you're looking for a cholesterol of less than 200. That's really, the normal range, less than 200. Then we break it down into two types of cholesterol. The good cholesterol, as we call it, or what's called high-density lipoprotein, that's cholesterol where you want that level to be 40 or greater. It's a little different range. You want it, the higher the better. It's the good stuff. Helps clean out the pipes, so to speak. On the other side is the bad cholesterol, or what's called low-density lipoprotein. That number you want to be less than 130. So those are things that we're going to be screening for there. We're going to be rating each of these criteria and risk factors and then giving you kind of an overall score for your relative risk.
And the good thing is if all of these numbers are jumbling up in your head, if you don't understand what they all mean, you guys will be there to explain it and break it down and then do the actual screenings for them. So they walk away informed also.
Yes. The students from the program will be there and give input. They actually have a tool they'll be using, so it'll be very standardized for every patient.
There's also a screening for smokers or people or some information about why you shouldn't maybe be smoking?
Yeah, that's kind of the fourth screening, and basically it's a yes or no answer. But yeah, we certainly will reinforce and try and emphasize smoking cessation. 1 in 4 deaths in this country is somehow related to or linked to smoking.
All right. Well, we're going to get you to stick around and answer some of our viewer questions in advance of the expo. We're going to get all the information we can. So right after the break, Jack Goebel with CCBC is going to be back to take your calls about the health screenings you need and knowing your numbers. So if you have a question, our phone lines are open right now at 410-481-4545. You can also send us a tweet at Fox Baltimore or go through our Facebook page. And Fox 45 is doing all it can to make your 2012 the healthiest year yet. The Fox 45 CW Baltimore Bmore Healthy Expo in partnership with MedStar Health is this Saturday, March 17th at the Baltimore Convention Center. Learn about exercise, eating right, and get those health screenings. Go to bmorehealthyexpo.com for more information. You're watching Fox 45 Morning News, all local, all morning.